Hello, everybody. My name is Jhia, and how do I zoom this? Okay. Hi, everybody. My name is Jhia, and I am an RN. Also, I have a bachelor's in science and nursing, and I'm currently working on my master's at University of St. Augustine for health and sciences. Yeah. So today I'm going to discuss or like a brief discussion about acid base and acids, which is one of the basic things that you have to know in nursing. Whether you are about to take your exam or you're on your second year or your LPN, doesn't matter. It's really one of the basic things. Um, Especially if you're gonna take your exam, actually. Yeah. Right. I haven't met anyone that did not encounter this when they took their tests. When I actually my students, when I asked them how was your exam, they're gonna say, oh, there were ABG interpretations. So you will encounter this definitely. Okay. All right. So this is my chart. I made this chart when I was studying for my NCLEX. This is just how I understood it. If it's up to you if you want to use it or not. I say that this is a secret made by me, but it's really up to you. Okay. Now later on, you will see why I think it's unique, right? Okay. So these are what you call parameters, all right? ABG parameters. So you see numbers and you see some basic, words there that you just need to know, right? Books have with all kinds of explanation, which is for me, this is the easiest way. Okay, let's start. pH is directly affected. pH, and if you see that line there that I made, pH and hydrogen ion is directly affected. Constant, consistent, constant, directly affected. If there's something happening with your respiratory or your kidney, pH and hydrogen ion is directly affected. Carbon dioxide, the only thing that you have to know is carbon dioxide is an acid. Okay, and the organ that regulates it, well, of course, it's lungs. Partial gas, carbon dioxide, is also an acid, well, because there's carbon dioxide there, and it's in the blood. Oxygen saturation, also blood. Okay, it's in the blood. Now, bicarb is an alkaline, and the organ that involves is kidney. Okay? And then hydrogen ion is an acid, by the way. Remember that, it's an acid. And the organ that is involved is kidney. Now, everything seems to be an acid, right? Except for bicarb. That's a good technique. I'm just saying. All right. So, the chart. The middle is all about normal values, right? pH normal value is 7.35 and 7.45. Anything above that is an alkaloidic side, and anything lower than 7.35 is more on the acidosis side. 35 to 45. Now I interchange it because it's easier to make the chart that way. It won't be so confusing, right? You just see the arrow and that's it. One of the tips I'm going to give it to you. If you don't like this chart, just make a chart, okay? Like if you see a question and it's, oh, this is ABG, don't answer the questions on your own, right? You feel like, oh, I'm expert on this, blah, blah, blah. You use your brain for it, you're just using like a mental vision of it. No, go make a chart. It's just like a quick, like a 2-second thing or 5 seconds. It's not gonna take you a long time to make a chart, okay? Especially if you already memorize it, right? All right. Next is your partial gas carbon dioxide, which is 35 to 45. And then if it's lower than that, it's alkalosis, right? Because carbon dioxide is an acid. So if it's high, it's acidotic. If it's low, it's alkalotic. Bicarb, like we said earlier, it's an alkaline element. So if it's high, it's going to be on the alkalosis side, right? Because it's an alkaline. And if it's low, it's acidosis. All right. This is the unique part of it for me. My PaO2. If it's low, the normal value is 80 to 100. If it's low, definitely. I'm telling you, patient is hypoventilating. Okay, it's one of my secrets. Well, it's not really a secret, but if you would read the books, patient, if your partial O2 is low, patient is hypoventilating. Definitely. Always. Now, you can use it in any question that will say, or, it doesn't have to be an ABG, if you see a PaO2 and they're lower than 80 or higher than 100, patient is hyperventilating. Always. Okay, it doesn't have to be an ABG, but this is it. This is my free tip for you guys. All right, oxygen saturation. Now, this is not new. You already know if you're already studying nursing. 95 to 100 is oxygenation part. This is oxygenation of your cells, right? If it's reaching the cells, basically. All right. Let's start with respiratory. Now, respiratory, of course, the organ involved is lungs. Don't answer kidney, please. Oh my God. I have students, I don't know where they studied or who taught them that, but if I didn't put that lungs there, if I asked if respiratory acidosis, what is the organ? They're going to say kidney. I don't know why, but it's always going to be lungs. All right? Respiratory acidosis or alkalosis, lungs. Okay, something is wrong with your lungs. Okay, and what gas is involved? Of course, it's going to be carbon dioxide. It won't be a bicarb or hydrogen ion. We already talked about it earlier, that the organ involved in carbon dioxide is lungs. And blood is also kind of an accessory in an organ. But the main organ is lungs. And the main gas is carbon dioxide. Now, like I said earlier as well, your hydrogen ion and your pH is always affected. If the lungs is acidotic, it's high on carbon dioxide, you already know that the pH is gonna be low. Okay? Your hydrogen ion is gonna be high because hydrogen ion is an acid. And they're both directly affected. Easy as that. You don't even need the numbers, but I'm just saying you still use the chart, okay? All right. So what is happening? There's 3 things going on, all right? Why the patient is acidotic. 1, there's a problem with the respiratory center. And where is your respiratory center? Guys, it's the brain. Right? It's in the brain. Okay? So, it's either they had some kind of brain injury or trauma, right? Or some kind of narcotics or sedative. That's why you always in post-op, you always check the breathing because, of the sedation that they had, anesthesia during the surgery, right? Number 1. Number 2, something wrong with pulmonary function. What is your pulmonary function? It's the exchange of gas, right? Oxygen and carbon dioxide, inside and out, lungs, all that. So if there's an obstruction, right? Pneumonia, and atelectasis, what is atelectasis? It's a lung collapsed, right? So if there's something wrong with the gas exchange, like your pneumonia, obstruction, or lung collapse, it's acidosis. Okay. Chest wall expansion. I just made an X there to easier for me to remember. I'm sorry. But so the chest wall expansion, it's one of the accessory for breathing, right? So if there's a rib fracture or what we call flailed chest, there's going to be problem with breathing. MG, what's that? Myasthenia gravis. And a mechanical ventilation issue. That's going to be a acidosis. Myasthenia gravis is more of a problem. It's a genetic condition, right? You're going to learn it more. You may Google it right now. I'm not going to give you free tips for that. All right, but yeah. So mech vent, rib fracture, anything that has to do with the chest wall expansion. Yeah, that's going to be an acidosis problem. Now let's go with alkalosis. Again, carbon dioxide is going to be the issue, the gas issue. If it's low, it's alkalotic. Now again, pH and hydrogen ion is directly affected. You already know that hydrogen ion is going to be lower, pH is going to be high. But there's only one thing that's happening. Remember, I told you, if the PaO2 is high, over 100, patient is hyperventilating. And it's not automatic alkalosis. Same thing here, hyperventilation. Okay, so what happens? Why is your patient hyperventilating? There's something wrong with, the CNS has been stimulated, basically. Something happened, stimulated your central nervous system, irritated. It's another term, okay? It's irritated. Like anxiety, fear, and panic. Patient is hyperventilating. CNS infection, irritated, right? Hypoxia can cause irritation. Fever, and again, mech vent. Okay.